My name is David Boyer. I'm an adjunct clinical professor at USC Keck School of Medicine in Los Angeles and a partner at Retina Ventures Associates Medical Group in Los Angeles.
Please tell us about the Apellis study for geographic atrophy in dry AMD.
So Apellis is treating patients who have geographic atrophy. The geographic atrophy is a portion of patients who go on from dry macular degeneration to either developing wet macular degeneration or geographic atrophy. And the incidence, is small, but it is a significant cause of decreased vision in patients who have dry macular degeneration. And up till now, there has been no real treatments that have been available. Even the vitamins, which we know are very helpful in reducing progression of dry macular degeneration, have really not stopped the formation or the progression of geographic atrophy. So these areas of geographic atrophy are actually areas where the photoreceptors don't function well. So wherever the geographic atrophy is, you'll have a relative blind spot, or what we call a scotoma in medicine. If it goes into the center, you lose the ability to be able to read and see people's faces, to be able to identify objects, and reduces your ability to drive. So we have not had any treatments until recently, and we have two studies that have shown very promise in treating this. The Apellis study is furthest along. It has completed, two 24-month studies, the Oaks and Derby studies. These studies had over 1,200 people involved, and what they did show was that there was a definite decrease at 24 months in progression. So what that means is it doesn't stop it, but what it does is it reduces the progression. So you can say, well, a 20% reduction, if it's not a fast-growing lesion, but that 20% or so reduction or greater is compounded. So it's 20% this year, 20% the next year, and continues on. So if you have someone who comes in early, who may have an area of atrophy that has not gone into the center, you may be able to reduce the possibility of that going into the center for a number of years and keep them seeing and functioning in society. So this is a very exciting time. The Apellis data and the Gather data are both showing similar types of effect. And the Apellis data that we have, we definitely demonstrated some definite reduction both in patients who had lesions going into the center as well as lesions outside the center. The lesions outside the center tend to grow more rapidly, so it showed a bigger response both in this study as well as the Gather study. So I think that it's a great time. We certainly hope that the drug will be approved by the FDA. If approved, then we'd be able to administer it. It is an injection, and there is some side effects. We note that there's a slight increased amount of patients developing what we call wet macular degeneration or neovascular macular degeneration. The incidence is probably somewhere around 10%, and the investigators found about 12% in the monthly and about 6% in the every other month, and a smaller percentage in the sham group. However, in the study, patients who had active neovascularization in the other eye were still in the study, where other studies have eliminated that. The reason I bring that up is those patients are at the highest risk of developing the problem of wet macular degeneration, even if they don't receive any treatment. So we have good treatments for wet, and it is possible to administer both at the same time, and we should be able to reduce progression. The only other side effect that was noted was a small increase in the incidence of intraocular inflammation, which was basically felt to be mild in almost all cases. The patients continued on treatment even if they had the intraocular inflammation, if they wanted to continue, and there were no recurrences of the intraocular inflammation, which is reassuring. It means that you're not getting an antigen-antibody reaction, they're not allergic to the medication. So I think that the incidence of infection was low and consistent with other studies that have been done. We do our best whenever we give injections. There's always a very small risk of developing a problem. So we're cognizant of that fact and do our best to try to avoid it.
What data is being presented here at AAO?
I'm going to present the safety data. The efficacy data is being presented by Dr. Rishi Singh, and Dr. Charles Wyckoff will be presenting at this meeting in the sub-day at 4 o'clock. He will be presenting all the data, both the efficacy data and some new data that's going to be coming out as far as microperimetry, which is demonstrating the size of the scotoma and showing some very interesting data that does show an improvement in the microperimetry, which is really what the patients want. You know, the patients really want to say, hey, the lesion's slowing down, because my patients come in all the time complaining, you know, every 6 months when they come in, it's gotten worse, it's gotten worse. I've never heard anybody come in that told me it's about the same. They all come in saying it's worse. So if we can reduce that progression, then we're actually helping the patient tremendously.
When do you expect this treatment to be approved through the FDA?
So the FDA, put what they call the PDUFA date, is the day after Thanksgiving. So if the FDA is really nice, they'll make everybody happy for Thanksgiving. Otherwise, it could be a Black Friday for everybody, I guess.
As an update to this story, the FDA previously had a November 26 deadline to decide whether to make pegcetacoplan the first marketed treatment for geographic atrophy. The review will now extend until late February because fresh results of 2 years of follow-up from a pair of Phase 3 studies constituted a major amendment to Apellis' application.